5 or 10 years ago, we were trying to work with physicians to get them to become waivered to prescribe buprenorphine, which is a medication for treating opioid use disorder. And a lot of the physicians are very hesitant to become waivered to prescribe buprenorphine, and their comment is, well, I don't want those kind of people in my practice. And we've got news for you. Those people are already in your practice, very, very normal people. I think there's a misconception around the type of people that could potentially have an opioid use disorder. I mean, a lot of times you'll see, teenagers and early 20-somethings that they were athletes. They broke a leg in high school and had to get an oxycodone prescription, and because of the way their brain is wired, they became addicted to those prescription pills, relatively quickly. Prescriptions dried up, and they had to find a new source for addressing their issues, so they may have turned to heroin. So it's really sort of a cycle, but could be a very normal teenager that had this issue, and that's just really not that uncommon at all. Initial issue was prescription opioids. A lot of changes happened that made prescription opioids more difficult to obtain. And so the epidemic sort of shifted from a prescription opioid epidemic to a heroin epidemic. And then that lasted for a few years, and federally, nationally, we started to get a handle a bit on the heroin epidemic, and then we started to see the fentanyl epidemic rise. So it's really been 3 separate opioid epidemics over the last 2 decades. You look at overdose death rates and other issues around the country. I don't know exactly where Georgia ranks. I would guess, given our size, I feel like we've been fortunate. And when we're out and about in rural Georgia and ask healthcare providers or law enforcement individuals about, what's the most significant drug issue in their county, a lot of them will say methamphetamines over opioids, particularly in the central and southern part of Georgia. As I mentioned, northeast Georgia has more of an opioid issue than some other areas of the state. What we really focus on is taking what's known to work and then working with community-based organizations to get it implemented as effectively and efficiently as possible within those organizations. We're trying to get naloxone into the hands of first responders in those counties. So naloxone is an opioid overdose medication. So if someone encounters an opioid overdose while they're out, either in an ambulance or in a police car or something, they'll have the medication that they need to reverse that overdose. With that grant, we purchased naloxone kits for every one of the medical students here at MCG, because they're all going out to do clinical rotations at some point in Georgia, and we want them to have a naloxone kit with them. And so what has happened over the last 4 or 5 years is there have been numerous lawsuits filed against these pharmaceutical companies. And Georgia, the state of Georgia, Georgia's Attorney General joined those lawsuits. And so what's going to happen is there's going to be a significant amount of settlement funds coming to the state of Georgia